15.2 Sports injury, physiological and psychological effects. Ellis Chapman. So, physiological responses of an injury. Uh, Bournemouth striker Callum Wilson ruptures his anterior cruciate ligament in his right knee in 2015 in a match against Stoke. When this happened, Wilson would have experienced a damage response mechanism. This is where Wilson would feel pain around the injured area and inflammation, which causes swelling. This is because there's been damage to the tissue, and the info of the damage is sent to the brain, so that these damage response mechanisms can begin to help recover from the injury. The pain is to stop the player touching the area and causing more damage, and the swelling is caused to fight from the infection. If Wilson was to bleed from this injury, such as Gaston Ramirez's cut on his leg, the clotting process would be needed to heal the cut. In the game against Brighton, Ramirez suffered a nasty blow to his lower leg, and this would need the clotting process. Firstly, chemical reactions will cause the platelets to be released, which make the blood sticky. This then allows for the blood to clot by sticking to the blood vessels. However, when acute injury occurs, the damaged tissue, so like for Wilson's injury, the damaged tissue is susceptible to bleeding outside the blood vessels and into surrounding tissues. This is known as hematoma. So there are two types of hematoma, intramuscular and intermuscular. Intramuscular hematoma is when damaged muscle causes blood flow within the damaged muscle belly itself. The blood therefore doesn't seep into surrounding tissue, and the blood is restricted, as it shows in the slide. An intermuscular hematoma happens when the damage to the muscles in the fascia and epimysium break, causing blood to escape and enter different surrounding tissues. This means that bruising will evolve around areas where the injury did not occur. The healing process and recovery after injury starts with the inflammation of the injured area to remove the pathogen for the repair phase. This occurs a few hours after the injury, but can last up to 6 weeks to make sure that the athlete's damaged area makes a full recovery and there is less chance for a repeated problem. Then there is the remodeling phase, of which scar tissue will replicate the original structure before the injury, and if the athlete allows for appropriate rest time, then the strength of the scarring will improve and the athlete can regain a full range of movement around that area. However, different types of injuries will depend on the needed amount of recovery. A first-degree sprain may see slight tearing with pain and swelling. However, the joint stability is good, and this may still take up to 2 weeks to heal. But a second-degree sprain has an increased range of damage, which causes instability and, in some occasions, quite severe pain and swelling. And this injury may take up to 4 to 6 weeks to heal. Finally, a third-degree strain is when the ligament has completely ruptured and the joint is very unstable. This causes very severe pain and swelling, as other tissues can also be damaged. And this dramatically increases the appropriate rest time to around 8 and 12 months. So, Callum Wilson's mental response to his severe 6-month injury would be hard to take, and many athletes struggle to cope mentally, not just physically, with their injuries. And these are some of the psychological effects of the injury. Wilson may be caused stress due to how he may not know exactly whether he'll be able to play again. Many players have had careers cut short by injury, and with that knowledge, he'll be anxious about hearing devastating news about the injury, where the doctor will say, "Oh, we feel you may never play again." This may also cause depression, as he'll be down about not being able to play top quality football, especially after just recently had scored a hat-trick in Bournemouth's first game in the top flight in English football. An isolation from the teammates may make him depressed too, as he won't be able to go out and play football with his mates. Being away from them on the training field for that amount of time will damage the relationship, and at times he may feel forgotten about. This may also link to fear, as because of how he may feel pushed out and away from the team, he may be worried and fearful about whether he'll regain a first team spot, or he may end up being benched or playing reserves for an extensive time. Fear of him being injured again next time he plays will be a big mental factor as well, and this will decrease the confidence he has, as he'll be less likely to make risk and he may pull out of tackles in fear of hurting himself again. But in fact, this may cause him an even bigger injury by pulling out tackles. Despite there obviously being psychological effects when you get injured, there are also psychological and mental thoughts during the treatment. New England Patriots quarterback Tom Brady suffered a torn ACL in 2008. During treatment, he may have had mental thoughts of anxiety, such as if the treatment was right and if it would be a success. Brady would have thought in the back of his mind that if he was to receive treatment and then enter the field of play um, again and then to be injured straight away, would so he'd be anxious about the right treatment. Frustration is also common amongst athletes receiving treatments. They want to be back on the pitch and eager to play straight away, especially with Brady winning NFL's most valuable offensive player and NFL's most overall player in the season before. He would be gutted and even more eager to get out and play. Also, after receiving treatment, Brady may struggle for motivation as they might have just missed out on an entire season and may feel that the players have excelled and he cannot be bothered to try and play at all and try and keep up with their level. But the use of goal setting will be important for him, as this will help him find the intrinsic motivation he needs to get playing and pushing himself to the top of his game. Goal setting is also good for taking your mind off the injury and just focusing on something else, as many athletes will have their mind on injuring themselves again and this will act negatively on their performance, but again they could also cause a repeated injury to themselves. Some more on Brady's injury. Started the first game of the season coming off the back of a promising season, um, which saw him win the NFL's most valuable player prize. However, in the first quarter, Brady collided with the Chiefs safety, which ultimately rolled Brady's knee awkwardly, which saw him require surgery and miss the rest of the season. Physiologically, the body would see intramuscular bleeding where there is only blood seeping from damaged muscle, but the platelets will make the blood sticky and stick to the outer blood vessels to stop the further spread. Brady required surgery on this injury to reconstruct the ACL tendon graft to help him regain stability. He'll also probably have scarring around where the surgery has taken place. Psychologically, Brady would be stressed and anxious about his return, as he'd never be the same player again and may never play again, which may also lead to him having the depression that he may feel he will never reach the heights the previous season was kind of looking up for him, having won all those awards. And another player, Harry Kuehl, in the 2005 Champions League final, a game only some players could dream about, ended in a nightmare for Australian Harry Kuehl after tearing his adductor muscle in the groin area just 30 minutes in, ultimately keeping out for 6 months. With this injury, Kuehl may have suffered slight intramuscular bleeding and would only need to go through the Price procedure and protection, rest, ice compression, and elevation. This would then allow for the healing process to begin, with rest over 6 months to fully heal. Psychologically, Kuehl would feel very frustrated as he has to leave the field early in a huge Champions League game, which Liverpool were in the end victorious within the end. So he may feel isolation from teammates as they managed to win a huge trophy without him, and also shared a huge achievement on the field without him.